As doctors, we get really engrossed in our patients and in our work, and it's our lives in many circumstances. It's what defines us. And I still recall reading a book called The House of God by Samuel Shem, which was written back in the 70s. One of the takeaway lines that stuck in my mind, and has stuck in my mind forever, is the patient's the one with the disease. So you can make a diagnosis, you can give some advice, you can give some guidance. That's a good thing to do, but if they choose not to follow that advice, that's their choice, not yours. You can give some great advice which they ignore, and things will go wrong sometimes, which is their problem by their choice. So don't feel guilty when they won't follow your advice. They're allowed to do that, but there are consequences to their actions as well. In terms of getting people to follow your advice, written instructions make a big difference. So if you tell somebody all the things you'd like them to do, they might recall about 30% of that. And so don't expect them to have a photographic memory and be able to just instantly replay everything you've told them. It doesn't happen. That's not what humans are. If you've got it in writing, they've got a reference source to go back to help understand that. The other thing I find is there's always going to be complications at some stage. Nobody has a 0% infection rate. Nobody has 0% bleeding after surgery. It's going to be 0.5% or 1% or 2%. It's going to exist. So if you do enough surgery, eventually things go wrong. If you've had a good conversation with the patient before the procedure, explaining these things, that these are the possible problems, then when it does happen, they're informed. And in fact, often they take the blame for it themselves. It's a really bizarre scenario where, as doctors, we feel uncomfortable saying this is what can go wrong, even though we know it's a real thing, that people will get infections. If we've explained that risk and explained how to minimise it to the patient before the procedure, and then it actually happens, the patient will come back and they'll be apologising to you, saying, "I'm sorry I've mucked up your good work." It's really strange, it's uncomfortable, because I'm saying, no, you're the one suffering here, so no, it's my fault. So again, that relationship with your patient makes a difference. Written instructions make a difference so they know what to expect. But have those conversations before the procedure so they are well informed and they know what to expect, and then you do get better outcomes. When complications do occur, they're also more likely to present with those complications early. So anytime someone's leaving after a procedure, my parting line is usually, "But if there's any problems, please let me know." It doesn't get abused. They don't come back and just ask about fiddly, annoying little things, but they do come back and say, "Oh, I'm sorry to disturb you, but it's bleeding," or "It's a bit sore, I'm not sure if it's okay or not." And you're always happy when you find an early infection rather than a late infection, because it's easier to manage. Really rampant cellulitis is difficult. They need hospitalisation and intravenous antibiotics. Early infection is simple to treat with some oral antibiotics and usually settles in a couple of days. So give permission to people to come back earlier, can give better outcomes when the complications do occur.